HonorHealth Shay. I'm Casey, one of the nurses here on the maternity unit. This is Christina, another nurse working beside me today. And we're here to get you prepped and planned for your delivery at HonorHealth, especially kind of during this COVID time. So first thing is I want to just kind of go over some of the changes, or really there's no changes since I last saw you. So our last video that we did was on April 20th. We went over a lot of the COVID-19 policies and procedures, and there have been no changes to those procedures at this time. So if you kind of have a lot of questions, or if you haven't seen that video, it's a good spot to check for resources, because hopefully it will answer a lot of the questions and concerns that you have. But we kind of walk through everything as far as if you're positive, negative, testing, what to expect. So just kind of take a peek at that back from the 20th, and you'll find a lot of the info on that there. But today we're going to kind of go over what's going to happen in delivery and what to expect afterwards, and give you some tips and tricks about what you can do during your hospital stay and afterwards to kind of get ready ahead of time. A few reminders I do want to kind of get out of the way before we get started. Arriving to the hospital, make sure you come through our main entrance located off 90th Street, just, south of Shea. If you see a big roundabout, you know you're in the right area. There's a lot of covered parking. Just go ahead and find a spot and head on into the hospital. First thing is you're going to get your temperature check and your mask, like Christina and I are wearing today, downstairs on the first floor lobby. So you're going to come right on in. You and your support person will get a temporal temperature check, so just right across the forehead, and then you'll each be given a mask to wear. So you don't need to worry about buying one or packing one. We will have them available for you here at the hospital. Remember, only one support person in the hospital. That person is not interchangeable. So only one the entire time, and that person will be given a little sticker. I'm wearing one, you can't see it probably, but those stickers are good for every day. So just make sure, support people out there, you have your stickers on so that way you can get in and out quickly, okay? When you come on in, you're gonna then go to the second floor, which is our delivery floor. You're gonna see a sign, just go ahead and make a right, follow the hall to the end of it, and you're gonna meet our maternity secretaries and then check-in staff out front. From there, we're going to get you back to what's called a triage room, and Christina's going to explain that in just a few minutes about what to expect there. And we're going to see what the day has in store for you, okay? What else do I want to tell you? Oh, right now, things are starting to open up again, so just remember, pregnant mamas, you are considered to be in that high-risk group, so please be diligent about your family safety right now. Talk to your OBs about any precautions that you should be using when you are moving about, just in public and whatnot right now. So please talk to the OBs, and they'll get you safe and sound about what to expect right now. What else do I want to mention? Oh, prenatal education. We are starting to kind of get our format back up and running. It's going to be an online format right now. We do have some awesome, we have had in-person classes in the past, and we're switching all that to an online format. So keep a lookout on our website. If you just go to HonorHealth and then select the maternity tab, you're going to see a ton of info on there. Just regular info regarding our policies with COVID right now. There's actually a virtual tour for here at Shea and at Osborne. So today we're coming to you live from one of our awesome labor suites, but you can take a peek at some of the other rooms that we're going to be talking about today as well on there. And if you're going to be delivering at Osborne, then you'll see one of the Osborne rooms. And then remember, if you are going to Osborne for your delivery, the family birthing suites is not attached to the hospital. So take a peek, make sure you know the address. You do not want to go to the emergency room to enter for either location. At Osborne, you're just going to go right to the family birthing suites, and here at Shea, you're just going to come to the main entrance. Okay. Last thing I'd like to tell you is we do have a COVID hotline here. So if you have any questions that we're not addressing today, or if you're like, shoot, I kind of forgot about that later, you can give us a phone call, and that phone number is 480-587-6200. Okay. So just give us a call, and we can help get all your questions answered at that time. All right, well, let's talk about the fun stuff, what you're here to find out today, and that is how delivering your sweet little baby is going to go. So Christina, when we first come to the hospital, we are going to head to triage. So what can we expect in triage? And we are not in a triage room. Take a peek at the tour. That room is different than this room, but that's where everyone starts their delivery. So what is going to happen to us in triage?
So like you said, the triage rooms are a lot smaller, but you're not going to be there permanently. You're just going to be there to be evaluated, whether you're in labor, preterm labor. Some people We'll call if they think they have like a GI bug or if they're dehydrated or they're just not feeling good. We'll evaluate you, mom and baby, and make sure you guys are okay. And then we'll determine whether you stay in the hospital or if you are admitted for labor.
Okay. And if we are determined to be admitted to the hospital, whether it's for an antepartum reason, which is something where you're admitted to the hospital prenatally, or in the labor department, that is when we're going to get tested for COVID, right?
Correct. And when you get tested for COVID, your triage nurse will be gowned in their personal protective equipment. So we're asking that your support person step outside, and then the test only takes about 15 seconds. It is uncomfortable, but it is bearable. I assure you that. Everyone comments on how they were shocked that it wasn't that bad. So we'll do the test quickly, and then once we are out of the room, your support person can come back in, and we have results within like 3 hours.
Mm-hmm. Awesome. And one of the reasons to leave the room is because when you are doing that test, it can kind of give you a tickle. You can maybe have a cough. And so we want to keep your support person as safe as possible if you are coughing and things like that. Okay. And in the labor or in the triage room, you'll also get to be on the monitor. What does the monitor look like?
So the monitors look just like this. I don't know if you can see it, but they're just basically, they're pretty long, so you can actually stand at the bedside even in your labor room or in triage if we don't have your labor room ready at the time. But you're just going to be hooked up to this. You can adjust the volume to your liking. We have some moms that prefer the volume up and some moms that prefer nice and quiet. So we can adjust that. Your nurses and doctors can actually view this from the nurses station, so they don't have to be in your room. You can have some privacy. And most doctors actually have access at home or from their office, and they can review your baby's heart rate tracing from wherever their location is.
Awesome. So we're going to be monitoring baby's heart tones and mama's contractions on this.
Correct.
And good news is we are not stuck to the monitor. So if we are COVID negative, then we can put our mask on and be out cruising the halls, help labor progress that way. Is that right?
Correct.
Okay, good. All right. So it has been determined this is not a false alarm. It is delivery day. Where are we headed next, Christina?
So it is delivery day. So you will head on into one of these rooms, depending on whether you want an epidural or if you're planning an unmedicated birth. You have access to this beautiful birthing suite. So you have a bed. We have birthing bars available if you choose to use that. We also have mirrors right behind Casey. You can see one. We are also having this amazing little baby warmer. This is actually a scale too, so we don't have to bring in extra equipment. This kind of does it all. So that's where your baby will be. We like to keep families together, so if your baby looks good, we'll keep you here. And that's pretty much it.
All right, so do we have a question?
We have a question.
We have a question. Okay.
Do scheduled C-section patients also go straight to triage?
So scheduled C-sections will most likely be prepped in triage. We'll pre-op you there, and you will get swabbed. And another little new note, I don't know if you touched base on it last week, scheduled C-sections should arrive 3 hours before your scheduled C-section versus 2 hours, which is what we were previously doing before COVID.
Mm-hmm. Yep, so if you have delivered with us in the past, normally we would say 2 hours, so just note that change. You do want to come in 3 hours prior to delivery, just so we can get the test results back with adequate time before delivery, and you have all the info that you need when you are delivering your baby. Okay?
Yeah, another question.
Okay, so as far as timing, kind of what to expect for the rooms, when you see the triage room, that is just where you're going to be in before delivery. So you don't spend as much time there as you do your labor suite. This is where you're going to spend the bulk of your time before delivery. Is that right?
Yes, you'll spend your entire laboring process in here, and then once you're delivered, your postpartum or your recovery will begin. And you're usually in these rooms for about an hour to an hour and a half, and then we'll move you up to our postpartum unit.
Okay, awesome. So a few other things about these rooms, because we do try to have make as home-like as an environment as possible. We want you to customize them as much as possible to your comfort. All these lightings can be adjusted, so if you're not really feeling the bright lights that we have on tonight or today, you can dim the lights and have some relaxation. The windows behind me, you can see we kind of have a privacy shade down. They do have blackout shades as well, so mamas, remember that those are there. If you're trying to nap during the day before delivery, pull those down, get some sleep. Like Christina mentioned before, the monitoring, we're monitoring you out in the nurses station. So if you're going to get some shut-eye, we can get you on the monitor and you can kind of take a nap. We're not going to interrupt you. These rooms come with luxurious sleeping accommodations. You probably can't see it, but it's behind me, the bench. for your support person. All these rooms are climate controlled individually. So if you're hot or cold during your labor, we get you a little bit more comfortable that way. These rooms also have refrigerators or microwaves. They're kind of in a cabinet that you can't see over this way. Mamas, those are not for you while you're in labor. Sorry, that is for your doctor, not me. But bring your favorite snacks for after delivery, because chances are you're going to be hungry, and it's nice to have some food right in the room ready for you, okay? And as you can see, this is a private room. There's a private restroom attached as well. Bathrooms have jacuzzi tubs, so if anyone's planning on laboring in the tub or shower, you can do so comfortably right in here. But I think this is an awesome spot to bring a baby into the world. I think it's one of the best rooms in the world because really, really awesome things happen in here. Okay, and time for another question.
So can you guys talk a little bit about what happens if the baby or mom tests positive for coronavirus?
Okay, so if mama tests positive, then you're going to have a lot of decisions to make as far as depending on type of birth. That won't be a decision that you're having. That'll kind of dictate who can be in the room and how you're going to proceed from there. So I'll kind of give you a brief rundown, but again, take a peek at the video last week because we had Dr. Cheryl Roth with us, our nurse practitioner, and she really went into that extensively. But if moms come in and they do test positive for a C-section birth, let's talk about that one first. So if you are having a C-section and you are positive, then the biggest difference right now is you will not have a support person in the operating room with you, okay? So you'll be in there with your nursing staff, your doctor, your anesthesiologist. I think our labor nurses here become your built-in, really, really fast best friend because even before COVID, this is just such an amazing experience, and you really spend a lot of time, and there's nothing more precious and amazing than bringing a baby into the world. So the staff here really do want to be here to support you, and that's what we're here for. So if you are having a C-section, then you'll be in there with our medical staff, and your support person will be in a separate room waiting for baby after recovery. For mamas who are positive, we do COVID testing on newborns at 24 hours of life. So your baby will get their test about then, and then same type of results, probably about 3 hours, we should be able to get all that info back, okay? For the vaginal birth, that's where you kind of have some decisions to make. So when you come in for delivery, and if we check you and you're positive, then explain how we're going to test our support person then if mama is positive, Christina.
So if mom is positive, your support person will go down to the ER and gets quickly swabbed, and once we know the result, we'll go from there. But if, let's say your significant other, your spouse, is negative, then you guys have to make the decision whether you want your support person to be in a separate room with the baby immediately after delivery, which requires your support person to not be in the room for delivery, but they will be waiting in a separate room for the arrival of baby. And your transition nurse will do all the weights, medications, and routine care in a separate room. If for some reason dad is positive, then we keep the entire family together. And we will bring in a separate support person to care for the baby and go from there.
Mm-hmm. Yeah. And all that is in a lot greater detail in our last video from the 20th too. And if you have specific questions, if it's something that you're worried about right now, maybe you're showing some symptoms and it's just definitely on your radar as it should be, please call your OB and they can go over exactly what to expect. And keep in mind, this is the most current info that we have today, May 5th, but things can change as this is a rapidly evolving situation. So just because we're saying this right now, it doesn't mean in 2 weeks something might be different. So just keep following along with us. We're going to be trying to put out weekly videos. Please talk to your OBs. They're the best guides for you right now because they are definitely up to all the policies that are going on here in the hospital. Or you can call our COVID hotline as well to stay current on all that. Okay. Alrighty, so let's briefly talk about a C-section because that's another method of delivery that happens here routinely. So if you're having a scheduled C-section, like you said, you're going to get pre-op and triage. So what does that kind of entail?
So what it entails is your triage nurse is going to go through all of your prenatal history, your past medical history. They'll start your IV. If you have a cord blood kit, please bring that so they can draw the blood vials for that. They will do your COVID swab. They'll give you some fluids since you haven't been drinking for 8 hours or eating, and then you'll also get some preoperative medications before surgery.
Okay, awesome. And then your support person gets ready as well. So mamas, you'll be rocking your hospital gown, and your support person is going to get some cool paper scrubs to put on, hairnet, face masks, shoe covers, the works. And that's just standard practice in regular times and with these COVID times as well. So once you guys are both geared up, you're going to head into the operating area. And here at Shea, we have our own hospitals. We have our own operating rooms. At Shea, we have 3 of them. And what to expect is once you get on in there, as long as you're COVID negative, mamas, you're going to head it right into the operating room with your medical team, an anesthesiologist. You're going to get your spinal placed in your back, and then you're going to lay back on the table and get draped for surgery, okay? During that time, your support person is going to be spending some time in a small private waiting room within the operating area, okay? That is normal. I promise you're not missing anything. Like I said, all that's going on is we're just kind of getting prepped for delivery. Once mom is ready, we're going to bring your support person right on into the delivery room. Usually that person's going to have a seat right at the head of the bed next to mama, and the birthday party is going to commence. Whole things are probably about an hour, maybe a little bit more, from start to finish with a C-section. With a C-section birth, you're going to hear your sweet little babies before you get to lay eyes on him or her. Your support person kind of can stand and peek over the curtain as long as they're feeling well, or you just stay seated safely and wait to meet baby with mama. With both methods of delivery, do we do anything special with the cord clamping as far as delaying it routinely?
I mean, we've been doing delayed cord clamping, I guess. That's been even before COVID times or not.
Awesome.
So
we're still
doing all of that. And one thing to mention, even though it is a C-section, you might hear your baby cry. The neonatologist will bring your baby over behind the curtains, and they'll bring them over to a warmer just like this, which you will have clear view from your operating table, and you can see all of that. And that's where we invite dads to come or support persons to come, trim the cord, and they'll help with baby medications and banding your baby, weighing your baby, and taking all those important photos.
Mm-hmm. So with the C-section, there is an extra staff. Like Christina said, we're going to have a NICU team member present at every delivery. That's standard practice for the hospital. You're going to have your nursing staff, your physician, your anesthesiologist the entire time. Here in the labor room, what should we expect for the birthday party?
So for the birthday party, you can expect, if you're having a vaginal delivery, your labor nurse will be kind of right over here, right next to the monitor. Your baby nurse will be over here, next to the warmer. The physician kind of takes this corner of the room with their delivery field, and then most support persons usually stand either on this side of the bed, just so they have actually the best view in the house because they can see everything. They're close to mom, they can see baby, and then once you feel comfortable and you're ready to weigh your baby, they'll bring the baby over to the warmer. Dads and support people can come and take pictures on all of that stuff, and yeah, that's pretty much it.
Yeah, and usually after the vaginal birth, when babies are born, they're going to come right up to mama's chest for some awesome skin-to-skin and snuggle time, which is really, really great, okay? After a C-section birth, you're going to have that drape, so it does take a little bit once we kind of get you all situated and kind of heading back to the recovery room is when you can start getting your snuggles. So your support person is the first one that gets to snuggle your sweet little baby with a C-section person, or C-section delivery, okay? Christina, what have some patients been doing as far as staying connected? Because it is tricky right now having only one support person available in the hospital. How are people staying connected, and what are some things that we can do to kind of connect with our family during such an important day when they're not physically here with us?
A lot of patients have been doing FaceTime or video chats. They've been really keeping their family updated. We've gotten really creative family members. We had a family member the other day that wrote cards for different milestones. So I think her sister wrote, "Open after your first family selfie," and had a card written, and just all these really cool positive messages. And it was just a beautiful way to have family members here, even though they're physically not here. Mm-hmm. So that's been really awesome to see. We're really getting like the best advantage in this situation with the golden hour. We're having uninterrupted golden golden hour. Moms are able to enjoy that first hour. We've even had moms say that this is their fourth child and they were really upset and emotional that the sibling is going to be here right after the birth. And we've actually had moms say they were pleasantly surprised because they actually got to bond with this new addition to their family, and they just enjoyed it, and they didn't feel selfish for leaving family members out. They just felt like it was just a blessing in disguise.
Yeah, that's awesome. As far as preparing or packing for the labor room, it seems like we have pretty much everything that we need here. We're going to have linens for both beds made up. We'll have supplies while you're in labor. We have obviously the mirrors. We have the squat bars here. What are some of the things that maybe we should be packing for our labor room specifically?
For the labor room specifically, most people are staying 24 hours after a vaginal delivery and then 48 hours for a C-section. So I say pack light, but think about like stuff that makes you comfortable at home. So think about like the music you like to listen to. Maybe bring a small little portable speaker. Just like simple things. There's a ton of outlets behind your bed. So if you want to bring like a long charger so you can have your phone, your tablet, your Kindle, or something to kind of occupy your time, go for it. We've had couples bring like cards if they want to play cards, and just like some kind of game or anything to pass time. So, and yeah, those are some ideas.
Alrighty. Well, then we are going to then talk about what to expect after baby's born. So like Christina said, after delivery, you're going to stay in this room for your recovery for about an hour and a half, and then you're going to head on upstairs to the couplet care unit after that. Our main couplet care unit's on the third floor, so most of our patients are scooching on up there afterwards. On the way, you get to announce your baby's arrival to the hospital via our baby chime, and that is a really fun memory to have. You can take pictures and video hitting the baby chime. You will have your mask on when you're out of the room, but make sure you guys are still stopping and hitting the button because it's a fun way to announce baby's arrival to the hospital, and everyone else that's here kind of can join in your celebration at the time. And then we're going to get you up to the couplet care room, and that's where you're going to stay for the remainder of your hospital stay. And like Christina mentioned, about 24 hours after a vaginal birth, you should be able to head home, and about 48 hours after a C-section birth. Of course, those are only kind of guidelines, as things can change and go on in your medical care. They may need to be adjusted. So your docs are going to kind of fill you in on that for sure. Okay. Once you head upstairs to couplet care, one of the first fun activities that's going to happen is your newborn baby bath and footprint time. And we don't do it at a specific time, just whenever you feel baby's ready. But one way a lot of families are kind of connecting, because you can't have that family member, grandma, grandpa, aunts, and uncles physically here with us, is our families are bringing extra cards for baby's footprints that they can then mail to their family members, so they can actually have something tangible to see how small or big their babies are at delivery. So we're going to go ahead and get footprints done. We're going to give your baby a nice little bath. And then it's a nice time for you guys to kind of rest and recuperate as a family. At the hospital, during COVID and non-COVID times, we do a few routine tests on every baby to be expected. We do a hearing assessment. We also do a blood draw to check babies for something called jaundice and to do the first state newborn screen test. All that's done right here in the room. So babies are actually going to room in with you the entire hospital stay, so from labor to delivery and to your couplet care room, as long as you are COVID negative, okay? One of the questions we got last week was about circumcisions. If you're having a baby boy and you're planning on that procedure, those are still going ahead as planned if that's part of your plan. And it's also dependent on your pediatrician. Anyway, so you'll kind of meet with your pediatrician, give them a call ahead of time, and if that is something that you're planning on doing, you can ask them about it and figure out if they are doing them here in the hospital or if they prefer to just do them at the hospital or at their office, okay? And that's the only procedure that's not done at the bedside, okay? Only other change for couplet care really that's been significant is our photographer. We don't have our birth photographer at the hospital, so just make sure you bring in your camera, bring in your cell phone, make sure they're charged, bring in a selfie stick. Those work awesome. And you can still get those great family photos that way too, which I think is really fun, okay? As far as supplies for after delivery, we're gonna have lots of supplies for your postpartum room. We're gonna have supplies for mamas. We'll have all the gowns that you could desire. We're gonna have different products for breast and bottom health. We'll have a pump if you need to start pumping. We're gonna have linens for everyone's bed. We'll have your baby's diapers, wipes, blankets, burp cloths, little t-shirts for them to wear with hand protectors on. while you can utilize in the hospital. So you don't really need to pack a lot for couplet care. Main things to definitely include in your overnight bag are your toiletries, because we don't have a lot of those here. So make sure you pack your shampoo and conditioner, toothpaste, toothbrush, all that good stuff. Comfy clothes, like Christina said, bring the comfy ones, because you'll be wanting those after delivery. I think flip-flops are great to pack just because it's nice to have some footwear. It's hot out, so you probably don't want a full shoe. And they usually fit if your feet swell. So those are definitely a good idea to bring with you, okay? As far as what you can be doing right now to kind of get your house ready, of course, you're going to want all the newborn baby stuff that you're always going to need. A few things that you might want to think about buying so you have them for your postpartum period are pads. So make sure you get some pads at the store if you're making a trip. That way, whoever your support person is doesn't have to run out first thing when you get home. You'll probably have a couple left over from the hospital, but you'll definitely need some more than that. So get some pads for home. You can start to make sure you have your postpartum medications. That's going to depend on if you have a vaginal or cesarean birth. And of course, if you have any allergies, you're going to want to be conscious of that. But routinely, those are going to be things like Motrin, Tylenol, a stool softener, perhaps a laxative. So check with your physicians and they can kind of guide you on all those medications. For my breastfeeding mamas, you're going to want to maybe think about having a pump at home, maybe a little backup formula if you needed it. Breast care items, there's some creams available that kind of help with breast care. There's hydrogel pads or different jelly pads that can be helped with some of the discomfort that you might experience breastfeeding. So I would definitely get some of those items and just have them at the house and ready for you after delivery. Anything else that you can think about our moms are going to need once they head home? I think that's most of it.
Do we have lactation consultants?
Yeah, we do. So we still have our lactation staff here, usually 7 days a week. We also have a lactation phone number. Let me tell you about that. So as far as some postpartum resources I wanted to give you guys today, we have lactation specialists. You can call our office here at Shea or at our Osborne location. We have lactation specialists, of course, at both. So for Shea, our phone number is 480-323-3638. And at Osborne, our phone number is 480-583-2964. So those are actual lactation specialists in-house, and you can call. We can answer questions for you over the phone, which is really, really great. Other postpartum resources that I want to mention right now, just because when you head home, there's always a lot of different things that could be going on. And you might be feeling different types of ways. And with everything else going on with the COVID, it can be a little bit stressful. So if you're needing to reach out to someone, your OB and pediatrician are great resources for all of your information. And then the other resource I wanted to give you guys today is for Postpartum Support International. We have an Arizona chapter here. And they work with our moms. They also work with dads. They work with a lot of family members in different aspects. And the phone number for them is 1-888-434, and then it's moms, which is 6667. And you can also take a peek at them online for the resources. If you just Google Postpartum Support International, the Arizona chapter, you should be able to find them. And they're also a really, really good resource for afterwards as well. Okay. Yeah, so I think that kind of covers up all the info we wanted to go. We'll kind of go and see if we have any other questions now. And then, we'll leave you for today.
Talk to us about wearing masks in labor or just in the hospital.
Okay, so you're going to always want to have your mask on. Like I said before, even if you test negative, just because you can actually have a false negative. So you're going to still want to keep that mask on for your safety, for the staff safety. So when you're out in the halls, you'll want it on, or if you have staff members coming in and out of the room, you'll definitely have it on. If I'm alone here in the room, you can definitely obviously untie and take it off. But these are not the N95 masks that you see Christina and I wearing. The medical team would be wearing those if you are COVID positive. So we have had a few questions in the past. Can I breathe through this mask? You can definitely breathe. You can see I've been talking to you today. My oxygen level has not dipped. And we're going to be monitoring that all anyways. But this is a very breathable, lightweight mask. And we'll have these, so don't worry about buying them. If you have any at home, you can keep those for your home use for after delivery. When you come to the hospital, just go ahead and get one of ours on and you'll be good to go. Mm-hmm. All right, guys. Well, I think that's all we have for you. Thanks for joining us today. Next week, I will be back, same time, same place, with our pediatrician, Dr. Sammy Weisberg, kind of going over what we can be doing to keep our kiddos, especially our newborns, safe in regards to COVID-19. So take a peek, and hopefully I'll see you again next week. Have a good week, and we'll see you soon, okay? Bye-bye.
Bye, guys.